Oh, that's bad. That will cause antibiotic resistance. Okay. So that's my goal. Make sure you guys, when you become a doctor soon, when I think, vâng, also 4 year, right?
Um, 5th year actually.
5 year, okay, yeah, you guys almost become doctors. So make sure that you know when to give antibiotics, when not, and make sure you follow the criteria. This is for children only. Adult is totally different. So here's I wonder if I can zoom in this thing. Yes, I can. So first thing we should do is ask ourselves. I ask you guys: is the patient look really sick? And rule out the dangerous stuff like epiglottitis. So if patient have epiglottitis, patient have usually they will lean forward and drooling. Okay,
Mm-hmm.
that's a sign and symptoms of epiglottitis. Retropharyngeal abscess, you will be able to feel it in the neck. You'll see like stuff in the neck that you can feel on palpations. Okay, and it's look really sick. And X-ray will actually reveal it. Okay? Tonsillar. So technically, you need to rule out things that are dangerous first. Okay, and all of this, I believe you learn in school how to tell them apart from regular sore throat. Okay, if the patient lean forward and start to like drooling, then that's concerning. Diphtheria, you will probably see it in the throat. You see the pseudomembrane. Okay. Now, because we're in COVID time, we want to see if this patient has symptoms of COVID. Well, nowadays, up to date recommend go ahead and test it because you don't really know. So go ahead and test it. If it's positive, good. That's COVID. Send to the hospital or tell them to quarantine. In Vietnam, it's impossible because right now there's no COVID in Vietnam, which is nice. Over here, there's tons of COVID. Yeah, I think the death rate just spiked up like a couple of days ago, and was one of the highest death rate in the period. So make sure you follow the criteria, follow the guidelines, okay? Because I'm a big guideline person. I'm usually just follow it because who knows. So if everything point toward to infectious pharyngitis, which is down here, then we start to go down here and see. This is the algorithm for infectious. So first of all, we want to see if there's any vesicle. Okay, if it's vesicle, then there's Herpangina, which is caused by Coxsackie virus. We also have a different term for it, hand, foot, and mouth disease. Okay. Now we want to see if it's posterior or anterior lymphadenopathy. Usually strepto cause anterior and mono cause posterior. So that's the way to tell it apart. Okay. If it's not posterior, then you do a rapid test. If it's positive, yes, it's strep. If it's negative, send it for culture. Okay. Do not send, do not do culturing yet. Okay. If it's negative test, do culture because I'm telling you, this test right here is have a high rate of false negative. Okay. We don't know. Send it to
Mm-hmm.
culture. Meanwhile, call in the prescription for antibiotic just in case, but tell the patient to wait. Don't pick it up yet. Okay. And then there we go. Just follow this. Okay. Here's a simpler algorithm for you. You can read it on your own. See, usually patient will look very sick if they have strepto. I'm telling you. Did you guys do pediatric yet?
Yeah,
Do the rotation in pediatric yet?
I've just finished the second rotation in pediatric.
Okay, you know what I mean, right? They have strepto. They look really sick.
Yeah.
Yeah, they don't look fine at all. They will
Mm-hmm.
just not responding to you. They totally hate you if you look at their ears. Okay. Usually these sore throat patients usually come with otitis media as well. I don't know. That's why they say ENT because ear, nose, and throat will stick to each other. Okay. All right. Questions.
So about case two, yeah, I think that the, the symptoms of this patient is quite kind of persistent. Yeah, with a viral infection, it just kind of recover in about 3 or 5 days. But this patient have been
Good point.
going with the symptom for 7 days, and she also have other symptoms, except of the respiratory tract, like nausea, vomiting, and diarrhea. So, should we do any other things to
Good point.
diagnose? Yeah, because
Good
I
point.
think yeah, be- because I think that the modified sensor score just help us to
That's
define
right.
whether or not the patient have the group A strep infections, but it not
Good
help
point.
us to yeah to kind of
Good job.
so
Good
what do
job
you think?
pointing that out. Because I'm telling you, because usually something come after virals will be a bacteria infection. So if patient have sore throat and it's viral, it can go away and it can come back with the actual bacterial infection we call super
Yeah.
infection.
Mm-hmm.
Okay. So because it's been going on for 7 days, okay, well I'm definitely concerned for that. But if it's not presenting with the bacteria yet, I'm not gonna go do anything until the patient come back. Okay. So usually this case you still send the patient home and ask them, hey, if he become like sick in the next few days, call me, call the office, and we will send out the antibiotics prescription. Okay,
Mm-hmm.
that's what we American physician do. I saw my preceptor. She does that because usually she warn a patient, hey, usually if it lasts this long, it will go away soon. But if your kid becomes sick after a few days, really sick, call us, okay? Or come in and we evaluate again because usually the super infection will be a bacterial one. Okay, it's weird because it's viral first and then bacterial. Okay, good point pointing that out. Yes, we do concerned, but we just follow the guidelines and there's no bacterial symptoms. Don't treat it. Okay, don't give antibiotics. So I want you guys to take out from this discussion is when to give antibiotic and not to. But there's always the red lines and the red lines area, like 2 or 3 points where you don't know what to do. Okay.
Mm-hmm.
So, well, there's a lot of people treat anyways because they want to cover the bases. Just go ahead and give antibiotic if you're afraid. If you're not sure, give antibiotics for 5 days. It's not going to kill the patients. Okay. Make sure you put the correct dose because kid kiddo dose antibiotics is different than adult dose. Okay, so make sure you give the correct dose if you happen to give antibiotic. I'm not gonna blame you to be a bad physician to give antibiotic all the time because I know you worry about a kid, so you just want to make it feel better. Also, the parents is the problem. Okay, I have to tell you so many times that I have to deal with the parents. They really hate going to the doctor and not getting something when they get out because they worry for their kid. That's understandable. But you have to educate them. You have to tell them, hey, your kid presentation may not be a bacterial cause. So that's why I'm not going to give antibiotics. Okay? You have to tell the parents that. You have to explain it to them. Otherwise, if you don't, they will like, hey, you're a bad doctor. You don't give anything for my kids. Okay? So That's sometimes I just write antibiotics for them to make them feel easier. But I'm telling them, hey, if your kid symptom get worse, take it. If it's not, don't take it. Okay, just have it there, keep it there. Okay, don't take it. So today we learn about Centor criteria. Okay, this only help guide you where you should do. Okay, it's not a complete. You don't have to completely rely on this. Clinical judgment is important. Okay, you have to see if your patient look really sick and need attention, need antibiotics. Okay, if not, then you'll be able to tell when you go on pediatric rotation. You'll be able to tell if your patient is sick or not. Because strepto, I'm telling you, look really sick. Okay. Any comments, complaint, questions? Again, Vung, you have any questions?
Um, I think yeah, I wanna just wanna confirm a bit because yeah, I have trouble hearing. So as you mentioned, if the patient has posterior no, posterior lymphoadenopathy, it may be mono. But
Yes.
how about the anterior?
That's strep. Usually.
I'm
Okay.
sorry. I
Anterior usually streps.
yeah. Okay,
Okay.
clear.
But it's not definitive. Okay.
Yeah.
Mono can present with anterior sometimes. But that's why sometimes in strepto, in sore throat, in pharyngitis, we don't really care what the thing is. We just go ahead and treat it. If it's viral, I don't really care unless it's pointing toward, screaming toward, hey, it's mono. Then tell the patient to do not involve in contact sport. Okay. But other than that, as I'm telling you earlier, we don't know if it's mono or not. That's why I'm going to tell the patient, hey, do not play contact sport for like 2 weeks, okay, until you feel better, okay?
Yeah.
Because what happened if it's mono, it's, they're going to rupture the spleen, okay? Don't want that. Dealing with sore throat is already complicated enough. I don't want to deal with another ruptured spleen. That's bad. Okay, so if it's viral, usually if I don't know it's mono or not, until I'm absolutely sure, just tell the patient to stay home for 2 weeks or go to school wearing face mask and do not play sport for 2 weeks. Okay.
Yes.
COVID, uh, shortness of breath, wheezing, decreased oxygen stat. That's probably screaming COVID right there. Okay, but this definitely not COVID. Okay. So, good job today. There's a couple pointers that I want you guys to pronounce. Practice your pronunciation. This is coryza, okay? Hoarseness, erythematous tonsils, erythematous tonsil with exudate, cervical lymphadenopathy, okay? Couple of things that practicing. Tonsillar erythema, okay? Chief complaints, okay? Not chef. Chef is cooker. Chef is cook, okay? Chief complaints, good. Nausea, vomiting, cough, diarrhea, okay? Now, if a patient have body ache, that's probably a flu. We probably swap for flu, okay? We always swap for flu. Sometimes the swab is negative, but we swap anyways, because who knows? Make sure around this time of year, get your flu shot if you go to pediatric rotation, because usually after pediatric rotation, you will be sick. Telling you, because I got sick after my pediatrics every single time. I will get sick. I will get sore throat by the end of the rotation.
Me too.
That's why I get vitamin C every day, like 2,000 milligram vitamin C every day. Boost your immune system. Get flu shot and
I
wear
don't
face.
Mm-hmm. I don't need to go to the pediatric hospital. I just stay at home with my nephew. That's enough for me to get sick all the time. Every
Right?
2 weeks per month. You
I know
can.
you also teach USMLE class. That's also get sore throat.
Yes, it's happened.
Okay. Any complaint question? Thank you for being here again. Only two of you, but well, you're very consistent with your study, and I hope you learned something from this. This is a very easy thing, but it's also a very complicated thing to do. It's not to give antibiotics. I know we worry about patient, but sometimes we have to worry about something else is antibiotic resistance.
Yeah.
It's not like amoxicillin will cause really resistance because now we have a stronger antibiotic to kill it, which is amoxicillin with clavulinate. That kills everything. Over here is called augmentin. Okay.
So I just have a little bit concerns about the second case that we
Yes.
have the symptom and the intact in the gastrointestinal tract. So should we do anything with the symptoms of diarrhea? I mean that we need to have the further description about
Tell
the
patient to drink a lot of fluid
yeah
and
the,
just wait for it to go away.
mm-hmm,
Usually, if it's a GI symptom, I'm worried about the gastroenteritis virus.
mm-hmm,
Usually, it's just a virus. But you know that virus can also cause sore throat. Who knows? It's viral in general. Just make sure to tell the patient get a lot of fluid, drink a lot of water. Okay, make sure like maybe you can prescribe some antiemetics for a patient to not nausea. Okay, because I know it sucks to feel nauseated. You can give some ondansetron, I guess, to prevent from nausea, vomiting. But it's all supportive care. That's why I say supportive care, because you do everything to make the patient feel better. Okay. So I leave it to your judgment if you want to give antibiotics or you want to give anti-vomiting medications and anti-diarrhea medication. Usually, if it's been going on for 7 days, you can tell that usually go around day 9 that the symptom will probably get better. The GI symptom will probably get better. Okay. Usually, if it's a viral, I'll see the course from 3 to 7 days. Okay.
mm-hmm.
By the end of 5 days or 7 days, patient should get better. If not, then call the office. Come in. We see you. Okay.
Mm-hmm.
Yes, good concern. You're a good doctor.
Really
Are you planning to go to pediatrics?
me
Yeah.
Mm. How
yeah
you think?
I still consider but
I
I
mean, you
think that
almost graduate, right?
mm-hmm,
Yeah.
but I think that I love to work with children.
You need to think about your career now.
Yeah.
What to do? I mean, you can be a dermatologist. I'm not going to be complaining about it.
Hmm.
I know there's a lot of people like dermatology. Dermatology is good.
Is to get out lots of money. And this is a very,
Yeah.
it's not working hard.
All the pretty doctor are dermatologists for some reason. I don't know. They have good board score too. That's like amazing. I can't do dermatology. First of all, I don't have the score to go dermatology.
In
Second of
Vietnam,
all,
it's more easier. It's easier to get in hematology.
Oh, in the in Hanoi, in my university, it's also a top.
Top
Yeah, it's
in my
still.
in my city, in my university too. But recently, this degree is about the level. Now,
Mhm.
pediatric is a hotter.
pediatric
Yes.
makes a lot of money in Vietnam. I noticed. Pediatric do not make a lot of money over here.
So dermatology.
Dermatology make good money everywhere.
Yeah.
Okay.
People worry about their appearance more than they worry about, hey, I'm gonna die from COVID or not.
Also, because they can do about some caring about beauty, like beauty,
I know
etc.
you guys are ladies. I understand.
Yes, yes.
I
They
saw a lot of dermatologists go to skin, specializing more about skin's condition and practice stuff like that. Yeah, which is amazing.
they look not working hard.
If I have boss, I like to look at labs and I like to manage my patients in the hospitals and stuff like that. So I have my own reason for not going to dermatology. Plus, I don't have a board score for dermatology. They like 270 USMLE. It's like, oh, you guys are smart.
Yeah, they are really smart to get.
Plus, one thing is I cannot tell the difference between the rashes. They all rash to me. I can't tell because this kind of rash and that kind of rash. I have to look at the microscope to know what kind of rash is it. Otherwise, it just look rash to me. Okay. Vâng, what you want to do? You want to do pediatrics?
Well, actually, I'm still consider. There are
You still
many.
consider
Yep.
on your
There are
fifth
many.
year already? You should have think about what career you want.
I think I have such a long time, right?
Well, yeah, it's
I
a year.
I think that is a decision that I have to. Yep. I have
Yep.
to think about it a lot.
Mm-hmm.
Make sure you put a lot of thought into it because you want a career, not want a job. Okay.
Yep.
That's the
Mm.
thing. You want a career, not a job.
And she
So
also need more time to get involved in many kind of like
specialty.
faculty. Yeah.
Make sure you get friendly with the faculty so they write you a letter so you can apply for VinMed. Okay.
Again,
It's important. Hey,
again.
relationship
We
connection
can
can
do
get
many
you
things
really.
here except wingman. Wingman just one of the opportunity.
I
Doctor.
mean, but even not VinMed, the connection will get you really far. Make sure you know you have the connections because you never know. Hey,
Yeah.
when I interview for programs, my faculties actually know the program director.
Mm-hmm.
Okay? So I asked her, can you somehow send a email to program director, tell him that you're my favorite faculties and I'm the awesome student, stuff like that, okay? Well, you never know. It may get your foot in the door. It's a connection. A connection is a connection. So
Sure,
connection is very important.
yeah, it's a happen. It's a happen. Connection more than your ability. I agree with that. But
Well, not really. Sometimes your ability is judged, but connection is important. Okay, I'm gonna stop recording.
yeah, sure, you should. So, do you have anything to share with us about this? Because we see quite more page